Okay, class, do you want to know what we're talking about today?
Yeah!
We are talking about heart failure readmission.
Oh,
good subject. Nasty thing. I'm going to tell you why this is so important for us nurses. Are you guys ready?
Yeah!
Hey, did you know that on average it costs about $14,000 for each readmission of heart failure? I know.
No.
I know.
Oh my God.
I know.
So what brings you in the office today?
Well, I got all these symptoms and don't really know what to do about them. Gained a lot of weight. Can't fit my shoes.
Her feet's been getting real big.
Can't sleep unless I got 5 pillows.
Okay. Been taking your medicine?
A little bit.
Good enough.
I'll take a listen to you.
Okay.
Yeah, her lungs sound clear and they don't sound junky at all. And I don't know what she's complaining about today. She sounds fine to me.
Great. Perfect. Let's go to the next patient.
All right, let's do it.
Hello.
Hello.
What's going on today?
Well, I've been gaining a lot of weight. Can't breathe. I can't fit into my shoes anymore.
Her feet's been getting real big.
Oh, really?
And I gotta sleep on like 5 pillows. Cause I
Oh.
can't
She
breathe.
steals all mine.
Okay. So, how much weight have you gained?
About 20 pounds, I think.
Really?
Mm-hmm. Seems like it at least.
Oh, yeah?
Mm-hmm.
Why don't you have shoes on?
Cause I can't fit them anymore. They're too big.
All right, well, we'll go ahead and take a listen to you real quick.
Okay.
Just take some deep breaths for me every time you hear or feel my stethoscope touch your back. All right, so I hear some crackles in your lungs. Have you been taking your medication lately?
What medication?
Do you have congestive heart failure medication that you take every day?
Oh yeah, I think so. I'm not real sure which one to take though, so I just do whichever
Okay.
looks right.
Well, we'll go ahead and take a look at that today.
Okay.
All right, so let's check out these ankles. You said you had some swelling in your feet.
Yeah.
This board comes out for you. All right. Yeah, you do have some swelling. You got 3+ pitting edema. Okay, so based on your assessment, you had some crackles in your lungs and your 3+ pitting edema. So we're gonna watch you overnight. So we're gonna admit you to our unit,
Okay.
and we'll go over your medications and get everything checked out for you.
Sounds good.
Okay.
Oh my, I didn't see you there. Now folks, does it look like this patient is being compliant with their heart failure regimen at home?
You good in here? I got it. You good?
Another pillow. One more pillow.
All right.
What?
Hey there.
Hello.
Hey.
How are you feeling?
It's hard to breathe.
She might need another pillow.
Okay. I can go get some. All right.
All right, let's set your bed up a little bit. That might help you breathe.
Yeah, that might help a little bit. Yeah, keep on coming. Did it come anymore? Yeah, just keep on coming. Oh, that's good.
I
That's
got you
good.
some pillows here.
Ooh.
I got the good pillow.
There you go.
Thanks, buddy.
There you go. You want one more?
Let's see if we can fit one back
There you go.
There we go.
Nice and high.
Much better.
All right, I'm gonna go ahead and take your blood pressure really quick.
Okay, doke. Y'all having a busy day?
Yeah, it's pretty busy, but we're getting through it.
I'm glad y'all came in here to see me.
All right, so your blood pressure is 143/90.
It's a little higher than normal.
What's your blood pressure usually?
Well, the doc says when I take my meds right, it's been around the 110s.
110.
Mm-hmm.
Have you been taking your medications?
Some of them.
Some of them. Okay.
Mm-hmm.
Well, we can look at that for you today
Okay.
and go over it and make sure you have all your medications that you need.
Okay.
All right, I'm gonna take a listen to your heart and your lungs, okay?
Okay.
All right, can I have you sit up and I'm gonna listen to your lungs?
Yeah. Let's hope these pillows don't fall. I like the way they are.
Take a couple deep breaths every time you feel my stethoscope touch your back, okay?
Okay.
Thank you.
All right, sit back. So I did hear some crackles in your lungs. I'm gonna check your oxygen and see how much oxygen you're getting, okay?
Okay.
Am I in the way?
All right. So your oxygen says you're only getting 89%. So
Ooh, that's not good, is it?
no, we usually, for congestive heart failure patients, we usually want it around like 95 at least. So I'm
Okay.
gonna go ahead and call the doctor and have him write an order for oxygen and maybe get you some Lasix.
Does that mean I'm putting on a mask?
Well, we're gonna have the nasal cannula, so it goes up your nose and around your ears.
Okay.
So you won't have the big mask on yet.
Okay.
Hey, Doc. I'm in room 23. We need some Lasix in here, alright? And I already put her oxygen on, so can you go ahead and put an order in for that too? Alright.
Hi, my name is Abby Clark. I'm taking care of Beth Williams in room 23. She has some crackles in her lungs and 3+ pitting edema in her ankles, and her oxygen saturation is 89%. I was wondering if you would write a prescription for Lasix and oxygen to get her started. Okay. All right, I'll go ahead and get that started. Thank you.
Now, folks, are you curious to see where a patient is now? Ta-da!
I go to the bathroom.
Alright, here you go.
Oh, thanks.
2 minutes later.
I gotta go to the bathroom again.
Alright, here you go.
4 minutes later.
I gotta go to the bathroom again.
Alright, here you go.
Thanks.
All right, we're gonna recheck your weight now that the Lasix is going.
Okay.
All right. So we'll help you get to the scale right here.
I really don't want to see this
Alrighty.
number.
You've already lost 5 pounds. So the Lasix is working. Do you feel like you can breathe better?
A little better, yeah.
Okay.
Getting better. It's getting a lot better, actually.
All right.
Alright, I'm gonna look at your ankles here to see if that edema's gotten better. Oh yeah. Looks good.
Now, folks, how can we keep this patient out of the hospital?
Hello, Beth. My name is Dr. Kessner. I've been your doctor this entire time. You're looking great. I think the interventions we did are really working, so we're gonna release you today. Just make sure today. Yeah, you're looking great.
Okay.
If your symptoms get worse, come back, call your primary care. If he thinks you should go to the emergency room, just go. She's going to talk to you about the diet you need, and I got to run, but it was great talking to you. You look great. You look
Nice
great.
seeing you, Doc.
You look great.
I'm Daysha, I'm the dietitian. I just want to let you know, don't forget that DASH diet, okay?
Okay.
Alright. Don't forget your daily weights, the weights.
Yeah, make sure you keep up with that.
What's the dash diet?
I don't know what the dash diet.
I'm gonna teach you about the DASH diet.
Alright, so we're gonna get your doctor and the dietitian to come in and talk to y'all a little bit more about where to go from here.
Okay.
Sound good?
Mm-hmm.
Alright, they'll be in a little bit, okay?
Okay.
Thank you.
Hey Beth, my name's Dr. Kessner. It's great to
Hi.
meet you.
Nice to meet you.
I just wanted to go over a couple of things with you. We're thinking about discharging you probably tomorrow. You're looking great, but we just want to keep you to make sure your symptoms don't get worse.
Okay.
I'm going to go over your medications with you because the nurses told me we're having a little trouble remembering to take our pills and stuff.
Yeah.
Okay.
Just a little bit.
That's fine. So I'm going to send you home on Lasix. You're going to take 40 milligrams twice a day. I recommend taking your first dose in the morning before breakfast, and then your second dose at like 2 p.m.
Okay.
Okay? And then
You remember that.
I'll
Breakfast
remember.
and lunch.
we're going to send you home with some papers too that have all this down. But the Lasix just to get the fluid off of you, to keep it from building up on your lungs so you can breathe a little better.
Okay.
And then I'm gonna send you home on some propranolol. It's for your blood pressure. It was a little high here, so we're gonna make sure we keep that under control. You're already on it at home. I just upped the milligrams a little bit, okay?
Okay.
Some other things. If you feel symptoms like a heart attack, like there's a big pressure on your chest, there's pain raining down to your shoulder and down your arm, go ahead and call 911. And then, but if you're just having symptoms like you're having trouble breathing again, you're having the weight gain, go ahead and call your primary care first. See if you can go into him first, okay?
Okay.
Okay, you have any other questions for me?
I don't think so.
Okay, it was great seeing you.
Thanks.
Yeah. I'm Beta!
Hi Beth, I'm Daysha. I'm the dietitian. I'm just going to talk to you a little bit about your diet for when you go home. Okay?
Okay.
So we have something called the DASH diet to help with your blood pressure. So I want you to increase your fruits and your vegetables as well as your low-fat, non-dairy products. Okay?
Okay.
And another thing I want you to be aware of is the amount of sodium you're taking in. Okay? I want you to decrease that a little bit.
Okay.
And then I also want you to increase your potassium. So those are like your dark green leafy vegetables. Just
Okay.
because the medicines that the doctor put you on in your urine, a lot of potassium goes out, so I want to make sure you're keeping it in.
Okay.
You got it?
I think I
All
got
right.
it.
And here's a pamphlet to help you remember it, just in case you forget. My number's at the bottom. If you need to call me, please give me a call anytime.
That's pretty good.
It is.
All right.
Thank
Any
you.
questions?
Nope.
All right, great. It was nice
Thank
meeting
you.
you.
Nice
You're
meeting
welcome.
You today?
Yeah, they gave us these papers. They're very helpful.
Okay. All right. So, do you have any questions for us?
No. I just know I gotta take my fluid pill twice a day and my blood pressure medicine twice a day. And then I eat these good foods.
Okay.
Mm-hmm.
Then I hopefully won't be here again.
Yeah, that's our hope, to keep you out of the hospital.
Yeah, mine
get you
too.
better.
Mine too.
All right. Well, y'all take care.
Okay, thank you.
Look at our patient now. Now, class, how do you think we can keep these people out of the hospital?
Better education!
Dash diet!
Yep. Medication reconciliation.
Exactly.
Community resources.
I agree.
Exercise!
Oh, didn't see you there. Now, folks, does it look like this patient is being compliant?
How long?
I'm gonna teach you about the DASH diet.
Go.
I'm Beta.
Blocker.